Dr. Nagella, I think you are with us, sir. How are you today?
Oh, I'm doing great. Thanks for having me on your show.
Lovely. I'm so happy that you're here. So to me, there's such a connection between diet and mental health, diet and staying strong, diet and anger management, even diet and depression. I know you work in this area. I wondered if you could help us understand the connection between diet and general mental health.
Sure, I agree. There's definitely a connection between mental health and diet. I've seen it anecdotally, in the clinic setting. Also, there's a significant amount of research to support that, and evidence-based research. So based on the research, inflammation of the brain may play a significant role in causing or perpetuating mental illness and neurocognitive disorders. So what I mean by mental illness is the most common things that we see in psychiatry are depression, anxiety, ADD, ADHD, bipolar disorder, schizophrenia. Those are just a few, the main ones. And also neurocognitive disorders. What I mean by that is Alzheimer's dementia, that's probably the most common, and vascular dementia. So it turns out inflammation plays a major role in those conditions. A low inflammation diet can often significantly reduce or even prevent the symptoms of these devastating illnesses, while also improving cognition. So what I mean by that is increasing attention, focus, processing speed, and memory.
So, because I want to wrap my mind around this, and I want people to have very practical use. Is this something that, changing your meal plan, like let's say you just change what you eat for breakfast, is that enough, or do you really have to go 100% getting rid of the inflammatory foods, which is basically meat and dairy and sugar, I believe?
Right. I always recommend going as far as possible, because you just get much more robust results that way. So the ideal low inflammatory diet is the whole foods plant-based diet, based on all the research that I've done on this topic. And so this is the whole foods plant-based diet is centered around fruits, veggies, nuts, seeds, whole grains, and legumes, while minimizing processed foods, refined sugars, animal products, and refined carbohydrates. One question I get frequently is, where am I going to get my omega-3s? Because a lot of people just assume that they should just get it from fish, but ideally they should be getting it from walnuts, flax seeds, and chia seeds. These are excellent sources of omega-3s that improve cognition and mood. While fish, they do provide omega-3s, but they also increase cholesterol and saturated fat,
and mercury,
which can predispose to increased risk of heart disease. And they also, fish, we have to remember too, they often contain mercury, PCBs, dioxins, which are harmful to our body.
So something that I'm a big fan of is hemp seeds, just because I don't have to grind them like you have to grind chia and flax seeds. So they also give me some omega-3s and omega-6s, so I try to work that into breakfast actually every day. Funny that you mention it. I can understand what you're saying about diet and depression, because of course if you're not feeling well, and to be fair, that might even be true if you were living on, let's say, Twizzlers, which are vegan, but maybe not really what we're talking about here. So you really want to keep the processed foods to a minimum, even if you are vegan. But I can understand the correlation between depression and diet, because if your diet is making you not feel great, you're gonna, it's gonna slow you down. But I've heard plant-based athletes talk about the connection between diet and anger management. And once they went to a plant-based diet, they were able to really keep their anger issues in control. I wonder if you ever see anything like that.
Yes, I do actually. Yes, research definitely shows that anger, hostility, and irritability are symptoms that we often see in depression and anxiety. And the research shows that a low inflammation diet, such as the whole foods plant-based diet, is shown to reduce these symptoms. Foods that actually have a higher tryptophan content include saffron, leafy greens, sunflower seeds. The reason why tryptophan is important is that tryptophan is an amino acid that gets converted to serotonin in our body, in our brains. So any foods that increase serotonin will help you treat depression, anxiety, and anger more optimally.
I thought tryptophan was something not good for you, so thank you for schooling me on this. I thought it was found in turkey. Do I have that wrong?
It is, but I think there's healthier sources of it. So This tryptophan we wanted to convert to 5-hydroxytryptophan, which is actually what serotonin is. But there's healthier sources of serotonin in tryptophan out there than turkey.
So you really advocate for a whole foods plant-based diet, and I'll say as a recently licensed Food for Life instructor with the Physicians Committee for Responsible Medicine, I do too. So help me help people walk them through that. So can you give me some examples of what you would suggest people eat on a daily basis?
Sure. I mean, I think what you were just talking about before, we were talking about leafy greens, broccoli, mushrooms, saffron, sunflower seeds, pumpkin seeds, fruits, vegetables. Kale is excellent. Sweet potatoes,